Medical AI agents today are expected to do more than just answer questions. They need to work with real patient data, follow clinical rules, and even take actions like ordering labs or medications. There are already good evaluation frameworks like the MedAgentBench, which define these kinds of medical tasks. And today I'm going to present the Green Agent, which is the agentic evaluator of the MedAgentBench for testing medical AI agents. So the Green Agent is the evaluator that orchestrates the MedAgentBench evaluation. It uses two standardized protocols, which is the A2A protocol for standardized communication with the assessed agent and the MCP protocol for fetching the tasks and the prompts related to this evaluation. It also validates the responses from the assessed agent with comprehensive failure taxonomy, and it enables plug-and-play evaluation of any A2A compliant agent. So think of it like this: instead of having a script, the evaluation should act like a proctor, controlling the tasks, the environment, and the scoring, and be able to test any compatible medical agent. The system consists of 4 distinct layers. First of all, we have the orchestration layer, which starts everything, and then the A2A agentic layer, which has the green evaluator and the purple agent under test. And then we have the MCP layer, which provides the tools, the tasks, and the available prompts. And then we have the FHIR data layer, which simulates the electronic health records. So first of all, the system would start from the orchestration layer, which starts everything, including the initializations of the green agent, the purple agent, the MCP server, and the FHIR server. And then the green agent would fetch all of the tasks and the prompts from the MCP server. And then it communicates with the assessed agent using A2A communication protocol. And then the purple agent, which is the assessed agent, would actually solve the tasks using the tools available in the MCP server, and then returns back the results to the evaluator agent. Now let's dive deeper into the A2A communication protocol between both agents. First of all, the green agent would discover all of the available purple agents, and I'm saying agents because the system could be running in parallel, each and every purple agent running on a specific port. Next, the green agent would send an A2A message. This would include a text part having the available task and a data part having all of the configurations required, like the MCP server URL. Then the purple agent solves the task and then sends back an A2A message, including a text part which have the final answer and a data part which have all of the tool history and all of the operations done using a post request, for example. So now let's talk about the available task types and what actually gets measured. We have 3 major task types. We have the read-only tasks like querying patient records. Then we have the action tasks like creating clinical records. Then we have the conditional tasks, which assesses the situation first and then decides if an action is needed. So what actually gets measured? Our main measuring criteria is the success rate. So a task could either be successful or the task failed. In order for the task to be successful, it has to be correct first, so the right answer should be there, or the right action should be taken by the agent. It also needs to be appropriate, so the agent should avoid any unnecessary actions. For example, if the task needs to be done by 1 post request to the database, then 2 post requests are deemed failure. Also, all of the post requests sent by the agent needs to include the correct arguments. And as an optional metric, we are measuring efficiency as well. So what are the number of the tool calls done by the agent? We also have 2 level failure classifications, primary categories on the left-hand side for aggregate stats, things like answer mismatch and payload error, and then we have detailed reasons on the right-hand side for debugging, grouped by format, operation, and resource type.